Now, skin boosters, it's a really big umbrella term and it can be confusing. If it's confusing for me as a practitioner, it's definitely going to be confusing for you as a patient. So going forward, we are going to label all of our injectable products that are not dermal fillers, but maybe hyaluronic acid based or biostimulators as skin boosters. Welcome to another edition of the weekly newsletter. I hope everyone has had a good week, and I want to share more news from clinic with you. Trends, skin trends, medical trends or medical information, mindset information. So, what is the point in these newsletters? Well, as I've spoken to many of you, it's my way of reaching out and sharing what goes on in clinic. As you're well aware, I love talking in appointments. However, I can't talk to everyone. So the purpose of these newsletters is to really share information, educate, and give you an idea of sort of what's going on. I hope to add value. I hope to educate. So really, as we've done these every week, as I've done these, I'm starting to get into a rhythm and really understand the basis of what we're offering here at Vysana. It is about life. It's about adding value. It's about looking at your long-term health. It's about looking at your skin health. So we're really focusing on skin health, medical health, especially from a hormonal aspect, perimenopause, menopause, female hormonal health. We can also cover sort of long-term health. We're also covering a little bit of mindset as well. We all lead busy lives, and I hope that these video newsletters add a little bit of value and a respite, perhaps, for listening in and learning a bit more to add value for you and those around you. One of the discussion points in clinic has been about general skin health. Now, we offer complimentary skincare plans through Get Harley, and if you haven't already got one, then please do email us and we can arrange either video consultation or next time you're in, adding that complimentary skincare plan in. Really what we're focusing is on what I can see and assess in clinic, and also listening to your concerns. So for very many of you, it might be pigmentation, it might be fine lines that are appearing around here, it might be rough or textured skin, it might be breakouts, it might be oily skin, or it might be dry skin. And we have a range of products and obviously an education piece to help tackle those problems. Moving on from the superficial aspects of skin and how we tackle that with skincare, I wanted to talk a little bit more about skin boosters. Now, skin boosters, it's a really big umbrella term and it can be confusing. If it's confusing for me as a practitioner, it's definitely going to be confusing for you as a patient. So going forward, we are going to label all of our injectable products that are not dermal fillers, but maybe hyaluronic acid based or biostimulators as skin boosters. So for example, this is Profilo. I've got it right. So Profilo is a skin booster. And the reason we call it a skin booster is that you inject it more superficially. It's not a cross-linked product. So what that means, it's not an implant like dermal fillers. It is still hyaluronic acid. But the curious or great thing about Profilo, and it's in terms of its mechanism of action, is it's a biostimulator. So when we inject this hyaluronic acid superficially into skin, usually in strategic places, as a sort of you might as well call it a lump. That lump diffuses in because the hyaluronic acid has no cross-linking to it, so it can migrate through the skin and replenish the dermis, which is that middle layer of skin where you get plumpness from. Now, if you haven't had Profilo before, you need 2 treatments, and then you have a maintenance treatment every 6 to 9 months, depending on how quickly the effects wear down. What does this give you? It gives you a glow to your skin. It gives you a plumpness. Most people, what they do is they comment that when they've had it done, that they get compliments about how glowing their skin looks or how well they look. Again, this is not a dermal filler, but it is hyaluronic acid and it's injected in skin. It's a biostimulator. Then we have the new kid on the block, really, which is polynucleotides. Now, this is actually Plinest I, just a label made by Mastelli. So we use various forms of polynucleotides. This is just one form. So how is polynucleotide different to hyaluronic acid? Well, firstly, it's a sugar molecule and it's a pure biostimulator. It does give a little bit of temporary plumping effect, but not as much as a hyaluronic acid would. However, it's a stronger biostimulator. You need more of these treatments compared to hyaluronic acid, but what this does, it stimulates your fibroblasts, your skin cells, to produce more collagen. Now, for many of you, skin boosters, whether it's a filler, a very soft filler like RHA1, which we can use in fine lines or forehead lines or lines that appear above the lip. This, for example, RHA1 is a great product. I'll go back to this. So in regards to RHA1, which is a dermal filler from Teoxane, this gives a little bit more of a long-lasting effect. So this is where where there are deeper lines, we want to inject this in and it stays there and it plumps up those lines. So for example, fine lines that are very deep here or very deep frown lines or lines above the lip, this is where we would use this. Now, if you're dead set against dermal fillers, then that's where we switch to skin boosters. You need more of these versus maybe 1 or 2 treatments with this. With a skin booster, keep flashing this up, with a skin booster, you'll need at least 3 treatments, depending on what it is. With polynucleotides, you need at least 3 treatments, 1 a month. With Profilo, when you're initially having it, it's 2 sessions and then a maintenance session. And skin boosters are usually separated out by 1 month, 28 days, 32 days. And the reason for that is because that's how long it takes your skin cycle, your skin cells to renew. And if we're stimulating them, we need your skin to catch up. We were just talking about skin boosters, and when we get older, when we're in our 40s and above, skin boosters are great. They stimulate our fibroblasts, they stimulate our skin cells and the dermis to plumpen up, to get a little bit thicker. It stimulates that more youthful level of dermis by acting on fibroblasts, skin cells. But there is a key component missing, which is one of the focuses about holistic health and approach here at Vysana, my approach, is that there is also a physiological driver that is lessening with age, and that is a loss of estrogen. Now, estrogen is very, very important for stimulating skin cells and fibroblasts. In fact, estrogen acts all over the body. So if we are using skin boosters, if you're under 40, great. It's a very effective treatment and you probably only need something like this once or twice a year. But in our mid-40s onwards, when we are going through potentially perimenopause, which can be almost 10 years long, yes, we're getting these great treatments, but we also have to think about the underlying physiological change. And that physiological change is there is a drop in estrogen, and we need to think about how can we stimulate that as well. We can do it conservatively. By looking at our diet, we can increase the amount of phytoestrogens we take, things like soya. Soya is a phytoestrogen. Increasing that in your diet will naturally stimulate the receptors in your body that maybe respond to estrogen. So it's kind of mimicking the effect of estrogen. And then, of course, there is the conundrum or the option of HRT, which is a discussion for another time. So whereas treatments with skin boosters, with dermal fillers are great at any age, we also have to think about the underlying physiological change, which is a hormonal change, and how are we going to stimulate our fibroblasts if they are also lacking in that estrogenic effect. Lastly, I wanted to end with a request or a favor. I would like to ask for your patience with me predominantly and the team as we do switch over our booking software. It's been a long, drawn-out process. I think because we have so many patients, because we have so many notes and so much information, we wanted to make sure that from when we transfer from an old system onto a new system, that we get everything right. However, with all things IT, it never runs smoothly, and we are in the last throes of getting this right. So it's half term next week. We're going to use half term effectively to make sure that both systems are matching up, and then we can move on to the new one. So all I ask is that please bear with us. If I do get the appointment timings wrong, I will always be flexible. I'm here to serve you, and I hope that you have a great half term next week. There will be a newsletter. There always is every week. I can't help but talk and share information with you. So for the rest of this week, for those of you who are watching, have a great week. If you're catching this on the down low, as they say, then I hope this is useful. As always, please do, if you're watching this on YouTube, or if you haven't watched on YouTube, go to our YouTube channel and subscribe and hit notifications. That helps us to spread the good word. If you would like to share this with anyone that may have an interest in maybe having treatments or just an education piece. And I look forward to sharing our forthcoming webinar. I haven't included the link in this one. We're just waiting for a few days to finalize the software we're going to use, and I look forward to sharing that next week. The link will be shared, and I look forward to sharing a amazing and very interesting webinar on how to flourish during these winter months and make your immune system resilient. Thanks very much for watching. I'm Dr. Dhesi from Vysana. Have a great week, and I'll see you soon.